Well, we do have it online under partner resources. You can also just email info@Text4baby. And what state are you from? What?
Montana.
Montana. We will let you know who we're working with already. Is a signed memorandum of understanding that people, basically sign up to work with us.
So say again how you do it.
I'm sorry, info@Text4baby.org. And we have 3 brilliant state coordinators who are working with 17 states each, and we'll follow up right away with what contacts we have there. They've been doing great, but Any other questions? Yes.
What proportion of the women who are being reached by Text4baby are first-time mothers?
That is a good question, and we do not know that well. Do you want to answer something?
Yeah. In the San Diego region, we have about 40% of our women first-time mothers who signed up. At this point, the others are some parents and other mothers.
So when someone signs up, we ask for very limited information intentionally. We ask when is your due date or your baby's birthday and what's your zip code, and that's it. That data can be very useful for people who are looking at zip code data and that kind of thing. We have now introduced some additional questions about who are you and how did you find out about us. But it does not ask that question, but we're getting a greater granularity about who our audience is, and some of these evaluations obviously will let us know more. Other questions? Observations? Inspirations for getting the word out? Yes?
Is there an estimate of sort of how much all of this would cost if it were paid for? How much is the industry sort of monetarily supporting the service through the free text? And so if someone was getting all these texts and they were costing us, how much would that actually be?
I think it is. Right, so data plan is $30 a month. I think that at one point we talked about, Kim, you know the answer to this?
At one point we talked about it being like a penny per message. So we've sent out, how many?
30 million messages.
20 million messages.
So there's a cost associated with it that we're thankful to for the carriers. But it's also when you divide it across the carriers, which we like to tell them, it's not that much of a cost, and it's worth every penny.
Literally.
Would that answer the question? Or just?
I think it's a positive thing. I think we just would be good for the industry coming together with some service. How much they're actually doing.
Well, we also, for example, with WIC, this new module that Yvette referred to, that will be including, that should be available in the fall. Basically, if someone, when they sign up, it says, please tell us your participant code, they can put in WIC, if they're a WIC member, so WIC, sort of CPA, I forgot what that stands for, but basically a person who's a provider for WIC can suggest to the moms that they're working with that they sign up for WIC. When they do, they put in WIC, they will get these additional reminders that they can put the word remind for appointment reminders. We know that in New York City, they're spending tens of thousands of dollars every year to mail to moms appointment reminders to call them, and it's still not working. So this is going to go straight to their phone, no matter how often they move. As long as their phone service stays the same, and certainly is going to save them that money, which is a significant amount of money for this local agency to be able to allocate to providing greater services. We'll do the cost-benefit analysis with you guys. Yes.
Can I ask another?
Sure.
I'm working with a group at the University of Mississippi for a very poor clinic in the Delta, and we're interested. We're making progress, but we're very interested in how you handle if people call or contact their healthcare provider about drug abuse, smoking cessation, violence, HIV, some of these other things. Do you have prepared information for the provider, or do you rely on referrals to specialized agencies?
So if I understand your question correctly, and others can jump in here as well, we intentionally do not try to replace the provider relationship. Doctors, nurses, midwives across the country are experts in providing health care. What we want to do is reinforce that relationship and give moms an actionable way to learn about something and then follow up either with their provider or, in many cases, almost a third of the messages, give or take, are to national and resources, hotlines for postpartum depression, for learning about Medicaid or CHIP, for learning about poison control, for dealing with loss in family, those kinds of resources that are available, and those are all of our partners who are working with us. There's also the possibility for states or localities to customize Text4baby so that all of those resources are actually local. So San Diego has customized Text4baby, and the hotlines and information are all local information. Hawaii, Missouri, and Georgia has just started that as well. We are introducing greater interactivity into the service, but we have to do that very cautiously and carefully in a way that does not give people any expectation or appearance that we're going to be managing their health care through text messages. What we want to do is reinforce the resources that are out there and give people clear directions for how they should pursue and address the concerns they have. That answer. Yes?
How is this tool being implemented by those who use the centering model in pregnancy?
Just had someone from the centering model yesterday. I'm not sure I know specifically. The centering model, as far as I know, is a peer-to-peer support approach that is sort of taking that concept and taking it to another level for pregnant women and new moms. Is that right? And so what we would hope with the centering organizations that are working with us is that they would incorporate and let their moms know about this. It would be a great thing to have moms sharing information that they learned from the text messages, raising questions, talking with them about it as part of a sort of facilitated way to increase their conversation and dialogue about this. The comments, there's been great evaluation information. 96% of Text4baby's users within the sample that we did saying they want to refer this to a friend. But I think the most important messages I get from moms is, saying this is like a best friend who knows a lot of information. When it comes to you on your phone in the middle of your hectic day, you could go to as many websites and read as many books as you want, but when the CDC, American Academy of Pediatrics, American College of Obstetricians and Gynecologists, and all of those other people are saying, this is the message you need to know at this stage in your pregnancy, in 150 characters or less. And this is how many times we're going to repeat it for you, whether it's breastfeeding or safe kids. And we do it in a friendly, non-authoritative way, but in a way that women can really act on it. I think it really opens up the conversation for us, our centering model type approach to take to a new level. So we're open to exploring ways to use that. Oh, I'm sorry, hi.
Any plans to expand outside of English and Spanish?
Well, Text4baby is actually launched a couple months ago in Russia. It's in Russian, but that's a very specific model. It's slightly different messages, obviously, because of the concerns there. We don't have immediate concerns. What we want to do first is really saturate better the United States with the messages that we have, with the language that we have. But there are endless opportunities for other languages, and obviously a critical need for additional languages. And it's something we would like to do. I think first and foremost, I want to make sure that 340,000 plus is a great number, but there are 4 million pregnancies and additional 2 million pregnancies each, 4 million births and 2 million pregnancies approximately in each year. And all of those women, as far as I'm concerned, should be getting a message when there's a ptosis outbreak, or when the American Academy of Pediatrics changes their guidelines, or when there's a recall about an issue, and we're not inundating, we're just giving you that one key message. So we need help getting to that volume, and then we'll do all the languages you want.
I'm interested to know how you message around addiction prevention, substance abuse. How do you message around it?
Specific messages, there are many messages, as you mentioned, on all the different topics, from nutrition, healthy eating, HIV prevention. I am not going to be the expert on that particular. We can send you the messages on substance abuse prevention. There are a number, and including drug safety, prescription drugs, as well as illicit drugs. And we do it carefully because it's I think it's a sensitive issue.
Several of the messages have hotline information too.
Several of those messages have hotline information that people can follow up if there is a substance abuse issue that they're dealing with. So I think I'll conclude, and then if there are additional questions, we can do it. Are there any last remarks or thoughts that you guys of the panel wanted to add? Again, my heartfelt thanks so much to all of you for coming, but also to the sponsors of this briefing, Senator Carper's office, Senator Landry's office, Senator Cochran's office, and Senator Ayo for your commitment and foresight in working with Text4baby. Please help us get the word out, and thank you very much.